Hello everyone. Hi. Today we are going to talk about postpartum GERD and a lot about it. I just have one request to everyone who are live with us watching this video. If you have any questions, please send a message to us and we will get back to you. We will definitely answer all of your questions by Dr. Shubha, because pile of questions waiting for her, and I doubt we will be able to address all of them in this live session. So if you all are having any questions, please send them to us and we will definitely get back to you. Hi Vidya.
Hey, hi.
Hi.
Yeah, Dr. Shubha is online. I think she will join us in a minute.
Hi Fareh. Yeah, I was just addressing the thing that we will be answering all the questions after the session, because I think we have a lot
Yeah,
of questions with us.
yeah, exactly. I'll just ping her, huh? 1 second.
Sure. I look so tired. I feel I look so tired.
Yeah, even I'm looking tired today. The effects of waking up early.
The effects of having a baby.
Ah, right. True. Did you receive any request?
No, not yet.
Hello, so many people are
Hi,
telling us.
Lina.
Hello, hello, hello.
Let's wait for a few minutes for her to
Yeah,
join.
yeah, sure, sure.
Okay, in
Yeah,
the meanwhile,
I
Vidya,
have
if you would
messaged.
like to talk about something like, what we are going to actually address in this session.
Yeah, sure. Actually, during pregnancy and after childbirth, she has joined. A lot of us new mothers face acidity, gastric issues, and constipation, but we really don't know why this happens. So we have an expert in the same field who will be talking about the same, why it happens, and what is the basic, how our digestive system is built, and so that you'll get an idea as to what you can eat and when you are feeling bloated or acidic or when you're having gastric issues, so that it will help you, reduce your problem. And when you have to go and consult a doctor, we really don't know unless, Hi,
Hi,
hello, Dr.
Subha.
Shubha.
Hello, hi, good evening.
She she didn't even freshen up, yeah, straight from clinic. Okay, she's joined live.
Thank you for the invitation, girls. What you guys are doing is a commendable job. So thanks for the invite. And I'm so sorry about the delay. Um,
No issues.
That's totally fine.
Thank
That's
you so much
okay.
for joining us in spite of having so many multiple things to take care of. Thank you so much, Dr. Shubha.
Thank you. And actually, this is my first live of 2022. I actually
Wow.
wanted to,
Oh,
I was planning one in January, but somehow it didn't work out. So this is my first live this year. So it's always special.
yay.
Dr. Shubha,
Yeah,
just one
Nilufa,
request to you,
Yeah.
since there will be a lot of comments coming in and you will be hidden under the comments. If you can position your camera so that, your face is lifted up, that would really help.
Is this, I don't know, is it okay?
No, there's a lot of blank space above your head, actually.
Okay, okay.
yeah, here.
Can I just cut
Yeah,
and call back again?
No, I think you can
yeah,
just
no,
reposition the camera.
I have to just lower it. Just give me a minute.
Sure,
yeah,
sure.
yeah, sure, sure.
Yeah, Vidya, you can continue
Yeah,
maybe what you were talking about.
yeah. Yeah, I personally had acidity issues during the last trimester. I think most women, when we had a small poll in our Facebook group also, there were many women who had it during their last trimester, acidity. Some women could not even drink water. Even drinking water was very difficult for them. So these things, and I had issues even after the childbirth also. Acidity, I have never faced it before. So it was all new to me and I didn't know what to eat, especially during that time, because whatever I was eating was only aggravating the issue and not reducing the issue. And though it subsided, we should know when we have to consult a doctor. And sometimes, acidity, when you have a lot of acidity, you have chest pain as well. But we don't know whether it is due to acidity or it's heart. I know it sounds scary, but it's
Right.
not nothing to scare anyone. But just, we need to know the basics. We need not know the technicalities of many things, not the words and all, but what usually happens and why it happens so that you can take proper step. So
Right.
that is
You are
what
right.
we are trying to cover.
Yeah. I think Dr. Shubha has sent a request again. Let me join.
Okay.
Hi, is it better now?
Yeah, this
Yeah,
is
it's better
better.
now.
No
Okay.
issues. Yeah, tell me. So
Yeah,
let's
Dr.
begin.
Shubha.
Yeah,
So I'll
Nilüfer.
start off.
Yes,
I'll
yes.
start off since we're already delayed, I'll actually start off with the first question. So what is GERD? Okay, we've been talking about GERD a lot. Okay, but there are many people out there who may not actually even be aware what actually GERD is in terms in layman's terms. Okay, so what is GERD and what causes GERD?
Okay. So GERD is a short form for gastroesophageal reflux disease, which is nothing but the reflux of food or acid or liquid or whatever from the stomach into the food pipe. So your food pipe is called the esophagus and your stomach is called a gastric. So gastroesophageal reflux disease. So there is a small ring or valve which connects the food pipe and stomach anatomically. So when you go back into our anatomy and study our organs, you realize that when this valve or this ring is little loose, this issue called GERD occurs. So normally GERD occurs in you and me and in everybody. It's a normal physiological
Mhm.
phenomenon. Children are born with GERD and it's very normal. To have a little bit of reflux every now and then is perfectly normal. But when it causes symptoms like heartburn or other complications, that is when it becomes a disease. Okay, so that is why it's
Okay.
GERD. But GER or gastroesophageal reflux is common in everyone. We also go through about 10 to 15 episodes of GER in an hour. This is given in our standard textbook. But certain people are prone to symptoms, certain people are not. So who are prone and who are not, I think as we discuss forward, we can take
Yeah.
it.
Yeah.
Sure, sure. Yeah. And what are the common symptoms of GER or GERD?
Okay, so there are benign symptoms, that is symptoms which can be addressed with home remedies, with not meeting a doctor, with just taking over the counter prescriptions. And there are symptoms which are quite severe, which can mean that this person is going to go in for complications. So the most common
Okay.
symptom will be heartburn. So I'm sure in Tamil, if we all say Nenju Erichal, they say my heart
Right.
is burning. That Nenji Erichal. That is the most common and primary symptom why everyone seeks medical attention. The first and foremost symptom would be heartburn. Second thing would be
Okay.
chest pain. Okay. Third thing would be reflux of food when you lie down or when you wake up from bed. You can, have this sour taste in your mouth, and what you had probably eaten a couple of hours before is now returning into your throat. So most commonly,
Mm-hmm.
these three things we see in people who have GERD, heartburn or dengue erichal, chest pain, and obvious reflux of food or maybe even liquid or milk or whatever. Either it comes up to the throat or sometimes they throw it up. That is, it's not vomiting,
Mm-hmm.
but it's called a spit out. Okay, like how children have,
Okay.
right? So the same thing can occur. So these are the three main symptoms. And when GERD leads to complications, there are other features like difficulty in swallowing, could also lead to pain in your belly, that is abdomen pain. And there are a lot of other complications of GERD, and one of the most dreaded complication is esophageal cancer. So I think
Okay.
people who have long-standing GERD should actually get treated, get investigated, go for regular checkups, because GERD can eventually lead on to esophageal cancer.
Okay, that sounds,
Okay. Okay.
really serious and
Very common question, and very I'm very
Yeah.
brought it up. See, the first and
right.
foremost thing is, previously they used to say that heart disease occurs only if you have BP, if you have diabetes, if you have hypertension, if your age is above 45. But nowadays we are seeing heart disease occurring in people who have no comorbids. Comorbids means no BP, no sugar. They're perfectly okay. Their weight is well. They are working out. They're eating healthy, but still you can have a heart disease. So that old age rule where they say that only if you are above 45 you have heart disease, that no longer holds good. So what I always tell my patients or family members is, when you have a chest pain which is not explainable by anything, okay, first go and take an ECG, rule out heart disease,
Okay.
because GERD does not necessarily warrant urgent initiation of treatment or urgent requirement for you to see a doctor. You can probably wait and go see a doctor in the morning if the ECG is okay. But if it's a heart disease, it could lead on to even fatal complications. So heart disease needs to be addressed. So whenever you have a chest pain, don't self-medicate or self-diagnose, or ask Google or ask your neighbor or ask your grandmother that is this GERD, is it heart disease? Go see,
Yeah.
get an ECG done first and foremost. I think ECG is available in any nearby hospital for 100 or 150 rupees these days. Okay, so just get a nearby hospital, go and get an ECG done. If everything is normal, seek professional help. If everything is normal, then we can brand it as GERD, and then we can take it forward.
Right.
Okay, okay. I was actually, my husband. This is just to ask you for more deeper in this question. My husband had a slight chest pain, and so yeah, we will be saving this live. Whoever is asking it. Okay, so when we took him, he did the same thing. So he went for an ECG. But first they gave him an acidity tablet, and they told him that, okay, if it will subside. And it did subside. He didn't again get it. So do you think this is a good way of treating it? So
How old is your husband?
36.
How
36.
old?
36.
36. Okay. Does he have any family history of cardiac issues or no?
No, no cardiac issues and all.
But any way above 35, if any non-specific chest pain, just basic ECG echo, it should suffice.
They did take an ECG later, but they first gave him the acidity tablet. So I just want to know, I got to know because I mean, he went. It could be the same treatment for somebody else also, for if a new mother is going, so they might give her an acidity
Yeah, you
tablet
need to
first,
go to the right
and
place
then
and meet the right people. That's all.
yeah,
So people need to be
yeah.
more aware. And in fact, these days you can walk into the hospital and ask for an ECG, or you can say, I want an ECG done. Nobody's going to refuse that to you. So
Oh, is it? Is it?
Okay.
life
That's a
is
good
more.
information. I'm sorry to cut you at this point, Dr. Shubha. That's a good information. So you don't really
Hmm.
need a doctor's prescription to get an ECG done, right? That's what you're
Not at all,
saying.
not at all. You can just say, I'm having some chest discomfort. Please do an ECG for me. Nobody is going to refuse. It's just
That
like you
that's
walking into a lab
amazing.
and asking for a blood test or a sugar test or even an ultrasound abdomen. You walk in and you ask, right, for a master health checkup. So it's the same thing with an ECG. Like, you just don't need to,
Hmm.
even get a doctor's prescription. If you're having any heartburn or any kind of chest discomfort and you think you need to get evaluated, I think a brilliant way will be to walk in and ask for an ECG. If there's any abnormality, the duty doctor will address it immediately. Okay.
So I think this is something that
Okay.
everyone needs
Oh,
to be aware of, like, medically, even if you
yes.
don't want to go and actually consult a doctor, you can actually walk into a hospital and get yourself evaluated. You can say you
Yeah.
want this
Nowadays,
question, you
even
can go
small
and
scan
evaluate.
centers are having ECG facility. Yeah,
Yeah, yeah.
Nilofer. They have these ECG facilities, even any small scan. But the thing is, the person taking the ECG may not be able to read the ECG because they have ECG technicians. So once you get it done, you have to go and see a doctor or a specialist to see if it's okay or not.
Right. And how this acidity, this reflex happens more during it's higher during the last trimester. So how to handle this, especially during the night when we are trying to sleep, it just keeps coming up and we don't know how to behave. We even got question saying that, not question, they an answer saying that she could not even drink water due to this in the last trimester during her pregnancy.
Okay. So the thing is, reflux throughout the pregnancy is common. Whether it's some
Okay.
people have it in first, some people in second, and most of the, I mean, I think more than 50% would have it in the third trimester. So why this occurs is because again, and going back to the structure of your body, you have your food pipe in the chest, you have your abdomen, and below that is your uterus. So as your uterus expands to give life to a beautiful baby, it's going to be pushed up, right? Your stomach and your food pipe. So as it's pushed up, there's a natural tendency for whatever you eat to come up. So this causes GERD or gastroesophageal reflux. It is very common in pregnancy. It is one of the physiological mechanisms of how your body changes. But not everyone gets affected with GERD. I also went through 2 pregnancies, and personally, I would not say just because you're pregnant is a dictum or a rule that you will get GERD. It's not that way. Sticking to a healthy lifestyle right from the initiation of your pregnancy or even in your pre-pregnancy period, and also adapting certain dietary recommendations and dietary modifications throughout your pregnancy. Third is maintaining a healthy weight gain during pregnancy. Fourth and most important thing is not immediately sleeping after you have your meal. So I think lying
Right.
down or the recommended position after a meal can actually aggravate GRD. So these are certain small points, and I also tell my patients who are pregnant who have GRD to have small frequent meals. Don't binge eat or eat a large meal at one go. So I have done an exclusive IGTV video on GRD in pregnancy on my handle. So they have given a certain tips of how you can actually control it at home. But beyond a certain point, there are again red flag signs where no matter what, you're not able to retain food and you have persistent vomiting and with streaks of blood. And because of
Okay.
this food intake is reduced and you develop constipation, all these are signs that home remedies are not going to work. You need to go and see a specialist.
Okay. Okay. So this can lead to constipation also.
Yes, see, persistent GRD leads to lesser food intake and a lot of vomiting also can be there. So there's no bulk to form your stools. There's no movement happening in your GI tract in your gut. So this can result in constipation.
Okay. So how about after childbirth, Dr. Shubha? How does acidity and acid reflux or GR, affect after childbirth?
After childbirth, see, after childbirth, generally it should minimize or completely disappear. So, considering that you had it only during pregnancy, so if you had it before pregnancy, then it's a total different ballgame. But if you had it only during pregnancy, following childbirth, it will reduce. Again, more active you are post pregnancy, the more faster you initiate your postpartum weight loss journey, and of course, to a certain extent, breastfeeding definitely helps in reducing GRD. And feeding in the,
Okay.
feeding as in uh, not formula feeding, but breastfeeding has shown to have a very important role in reducing GRD in the mother and in the child also. because formula
Wow.
Oh,
things
okay.
it can cause reflux, it can cause gastritis, it can cause throw up and spitting in the child. It's been proven with a lot of clinical research and studies. But again, I'm not judging. I mean, if a mother's not able to feed, then it's fine. I'm not judging. I'm not saying you have to breastfeed. But yeah, there are so many benefits of breastfeeding, even in the gut. So one of it is to reduce the GERD complication.
I'm so
Yeah,
sorry.
mine.
Stop. I'm so sorry, Vidya. People,
Yeah, yeah.
are having any questions, please post a message to us, and we will get back to you with Dr. Shubha's response. Okay, because right now we have a lot of questions, and I think the time we have set up for this session is going to like completely get exhausted in that. So if you have any questions, please post us a message rather than commenting over here. Thank you.
Yeah,
Yeah,
please.
actually, my next question was on breastfeeding, but you have already covered that. So, any home remedies to start with before we go to a consultation?
Home remedies, uh, diet, exercise, sleeping on time, lifestyle changes, reducing your portions during your meal, and avoiding smoking, alcoholism, definitely to a certain extent. And spice, on the other hand, does not have a direct role. If you have GRD, you can eat spice. There's no direct role to say that people who have acidity or GRD cannot eat spice. And first, an important thing would be caffeine. So too much coffee, too much tea can aggravate GRD. But you don't have to completely go off caffeine. You can maybe have one or two glasses or one or two cups a day is okay. And milk products, as in whole milk, not paneer, not cheese, not curd. I'm saying like whole milk, like milkshake, ice cream, uh, anything mixed with milk and had as whole milk, all that can aggravate GRD. So, milk products,
Okay.
caffeine, please avoid, and make sure you eat on time every day. Like breakfast between 8:30 and 9:30, lunch between 12:30 and 1:30, and dinner between 6:30 to 7:30. That is actually the dictum, the rule, and ensure you get adequate time after your meals and before you go to bed. At least 2 to 3 hours should be there. And if you're pregnant, a lot of people say that I get these hunger pangs. So if I have an early dinner, how do I, settle that? I will always say you can probably have a banana or two and maybe a glass of warm water. You will be sorted for the night. You won't get those hunger pangs again. And ensure you get an adequate amount of fiber in the form of fruits and fresh vegetables, because all this constitutes the bulk of your stools, the bulk of your the food which enters into your gut. So this increases the motility. So GRD means reflux, everything comes up. So if you have a lot of fiber, everything will just go down. So it constitutes your bulk, and you will have a really good bowel movement also.
Okay. Can drinking warm water after food help in this?
Definitely, definitely. Warm water after food, but
Okay.
again, don't have a huge or a big meal and then drink warm water, because that will again expand your stomach. Your stomach is like a beautiful small balloon. That is what I keep telling everybody to understand. And the mouth of the balloon, the Y, is your the ring which I was saying, okay? And your food pipe is
Okay.
the balloon. So if you are going to expand the balloon, add water, add a lot of things, instead of bursting, it will go up, right? So just imagine like that. So this
Okay.
is one of the
Right.
fundamental basics of GERD.
Yeah, I just
That
have one
was nice.
question over here. I'm sorry to interrupt. This is my personal question, Dr.
Yeah.
Shubha. So, we have been having, of lately, we have been talking a lot about cold and warm food. Okay.
Okay.
So, the question is about cold and warm food. What I want to ask you is, um, during pregnancy or during, the initial days or weeks that follow your childbirth, what do you recommend? I want your personal opinion. Is it okay to have cold, cold food as in, like say something cold from the refrigerator, or is it suggested to have something warm? Like, as we just spoke about, having warm water would definitely help your digestive system.
Yeah,
So, what is
yeah.
your opinion or your take on it?
To be very honest, scientifically, I don't know the basis of whether this is actually, addressed scientifically in allopathic medicine. But personally, I feel that eating things straight out of the refrigerator for a new mom is not very advisable. So sticking to warm stuff is fine. And only because of the fact that we are in the middle of the pandemic, we are in the middle of the flu, and every small running nose and allergy can be branded as the novel coronavirus. So stick to something warm which can actually, reduce your chances of getting even a small allergic rhinitis or a small running nose. Okay, especially during this pandemic. So it's better to be safe than sorry, right? So that is one thing. Secondly, I think you will be a better person to tell me whether or not, this concept of warm and cold foods, because I'm sure you must be advising a lot of moms about their nutrition and their postpartum, you know, uh, how do they start their dietary habits once they finish their delivery. So I would like to hear your take on this.
Actually, our take on this based on a lot of studies, okay, that both Vidya and me have done, and also we are not it's not just Vidya and me who are the voice of it. We have spoken to a lot of people who are actually working with pregnant and postpartum women, and their advice is to stick to warm food during the initial days, at least during the initial few weeks after you've delivered your baby. Okay, it's not about you are restricted out of some particular diet or anything like that, but then eating warm is definitely going to help your digestive system, because there have been studies which have proven that consumption of warm water, even warm water, is going to have effective bowel movements. You can experience that whether you're pregnant or not. Just have
Absolutely,
a
I
glass,
agree. I agree.
yeah,
Yeah,
just have a glass of warm water every morning, and you will have a
a
very
good
flush,
bowel movement. Yeah.
right? You will have a very flush stomach. So it does make a lot of sense to have something warm during your initial
Post
days
delivery.
after
Yeah.
your childbirth, or even during your pregnancy if you're facing any issues, so that you do not have you really do not have to stick out to medicines to actually change the issues that you're having. Instead of waiting for the issues to occur, it's better that you take proactive action and consume warm food, so that your bowel movements, your stomach are actually in a heat state, rather than waiting for issues to occur and then seeking out for allopathic medicine.
I understand. Okay. So nice. I also agree. But like I said, I'm not sure about the scientific basis in allopathic medicine which suggests warm cold. But I think our Tata parties, Nana, Nanis, would have suggested the same, right? So now that
Yeah,
we are backing it up, I think taking it on.
yes. Especially freshly cooked food, not previous day's food or, within 3-4 hours of after cooking. Yeah, if it is not possible, at least the food that is cooked on the same day is preferred, not from the previous day. Yeah, so that is about it. Yeah, Nilu, we
Vidya,
have
when
a
you said
question.
not from the previous day, there is scientific evidence to this, because the food that is reheated or consumed lately after it has been cooked, it kind of loses most of its nutrients.
Right.
So
Yes.
it's better to have freshly cooked food rather than having some frozen foods or snacks.
Yes. Yeah.
Right.
Over processed and frozen foods, any day freshly cooked foods is better.
Yeah, we have some questions from our viewers. I mean, who were. Uh, yeah, please go ahead,
Well,
Nilufar.
thank you for the idea, Dr. Shubha. I got to know from Vidya that it was, yeah, your idea to post a question on the story, and that
Okay.
had a really good response. We had a lot of people asking us so many questions, but I've just listed down a few of them, and I want to ask those
Sure,
questions
sure,
to you. I want to keep
sure.
the people's identity anonymous, because I'm not sure if they want it to be revealed. Okay, so I'm going to
Absolutely, yeah.
ask you. Yeah, I'm going to ask you the first question. It's I delivered in August 2021. Since then, I have been having loose stools almost every day. So, any suggestion for that?
So it could be, I mean, I want to know your history prior to delivery, whether you had loose stools before that, or you had it on and off, and after delivery it was aggravated to every day. And what was your mode of delivery? Whether it was cesarean or whether it was normal. And another thing is whether you are actually breastfeeding or not. Are you on any coexisting medications? Have you been on any long-term antibiotics? So there are so many questions I want to actually ask you before I can actually suggest anything. But the important thing would be I want you to be on a probiotic rich diet. That is, lot of fermented foods, lot of natural fermented probiotics like buttermilk, like idli, dosas, dhoklas, kombuchas, lot of kimchi, lot of curd, and so on and so forth, and not probiotic supplements. Okay, so I would require a big history, but generally, new mothers, the most common cause of diarrhea is stress or anxiety because they don't get much of the sleep. And now we have something called the mind gut connection, where studies have shown your mind, your stress is related to your gut. So this is the basis of treating IBS or irritable bowel syndrome. So IBS is again very, very common. And so one, first and foremost, I would think IBS. The second thing would be any kind of chronic gut issue which has been precipitated by antibiotics given during delivery. So I know a lot of mothers would probably take antibiotics before or after delivery, or even for some urinary infection or for their stitches to heal. So it depends on doctor to doctor. Antibiotics can throw your gut havoc. It can be very, very detrimental to your bowel habits. So again, IBS, I would first put it, up the list, treat her or him as IBS, and then followed by chronic gut issues like antibiotic associated gut issues. So I think
Yeah,
both
Okay.
thank you for
I
that, doctor.
is
Thank you for that, Dr.
important.
Shiva.
Yeah,
Yeah. Sorry, Vidya.
there was something. Sorry.
Yeah, I wanted to ask something. So, see, dhokla, when you said dhokla, right? You're telling the traditional way of making it, that is fermenting the batter, not using the
Yeah,
ENO
not
one, right? The
using
fruit salt.
fermentable substances. Yeah, it should be strong.
Yeah.
Yeah.
Okay.
Okay. Okay, so the person who have asked this question, please get back in touch with Dr. Shubha if you need to. Okay, because she had so many questions for you. You just had one question and she had so many questions for you. And if you really need to like consult her, please get to her and she should be able to help you. The next question that I have is how to get rid of stomach gas after delivery.
Stomach gas is not normal after delivery. It's not that everyone should have stomach gas. So if you have stomach gas, I will say that check your food, check your diet, and maybe you're going overboard with the milk intake because any new mother, everyone pumps them with milk. So milk or lactose gets converted to, a lot of gas in our belly, and this could get precipitated as both belching or noisy, leaving out noisy farts or noisy, really bad growling movements in your stomach if you're not able to take out that gas also. So first and foremost, I would say check your lactose content or lactose intake. And don't go in for any kind of processed or any dabba wala or any kind of supplements which say it will increase your milk secretion or your breast milk production. Again, that is not advisable because on the contrary, it could cause a lot of gut issues. So please be very mindful, very, very, thoughtful before you actually pick up a health supplement in your immediate postpartum period. Because I'm sure thousands of aunties and uncles and grandmothers will be saying this is good, that is good, and all that. So if you have a lot of bloating, lot of gas, check your milk intake and don't take any processed food. This should check it. And over and above, if it doesn't resolve, then go see a nearby gastro specialist and get it resolved.
Or you can also consult Dr. Shubha. She is available. So yeah, you can consult her. Dr. Shubha, I just had one question. When you said above others to increase your milk intake, there was something prescribed to me by one of my doctors. Okay, and it was called Gallstones, as far as I remember. Okay,
Okay.
so that was
Mhm.
something to increase. I don't know whether it was like as far as I have understood, the milk supply only increases if you're feeding more, and it depends on the demand and supply. But then
And your
Gallstones,
mental health as well. The more relaxed you are, the more your milk supply increases, right?
yeah. Agree to that. So, do you think, taking any kind of Gallstones is going to impact your GERD, or you say, gastrointestinal reflux? Is it going to impact it in any way?
No, see, Gallstones will not impact GERD, but it can cause a lot of gas formation in your belly. So it can
Okay.
cause
Mm-hmm.
it can cause other, leaving out a lot of gas. It can cause belching, but GERD actually will not cause.
Okay. Okay. I think I've experienced that.
A lot of bloating, a lot of gassy, substance. And in fact, your belly still
Yes.
looks like you're pregnant if continue that for a long time. It could actually look even more bigger than when you were pregnant.
Yeah, I can
Yeah.
relate to it. Okay. So we have the next question. It's been a month after delivery, and I am suffering from hemorrhoids from past 2 weeks. How do I overcome it?
Not answering this through Instagram DM. Please go see a nearby gastro specialist or come and see me. Postpartum hemorrhoids is very common because you will be constipated. I see a lot of mothers who strain, and bring out their stools, and it can cause even bleeding. In fact, even last week I did colonoscopy for a mom who had an 8-month-old baby who was literally bleeding because she couldn't tell her in-laws she had piles. I don't know why. If you have an issue, please seek out help. Whether it's your husband or your in-laws or your parents, nobody is going to stigmatize you. Don't bring it to the point where you have bleeding and you come in and you require a scopy to get it sorted. So I will say I'm not answering this on Instagram. It is not the right way to answer. Go see a specialist.
Thank you. Thank you,
Okay.
Doctor. Okay, the next question is, I'm facing constipation after delivering third child. Sometimes it's paining. How to get rid of it?
If it's paining, it means you have an anal fissure. That is, you have a tear. So every time you pass stools, when your stools become very hard and rock-like and you're constipated for a long time. So just imagine if there is a smooth pipe, okay, probably made of latex or something, and you put some hard rocks around it, it will get teared, right? Rather than sending something very soft down that pipe, there will not be tear. So the same thing applies to your anal canal, or the tube which is there through which you are excreting your fecal matter. So that can cause a tear. So when it tears, it's when you have pain. So if you have constipation and you're having pain, it means you have an anal fissure. So up your fiber intake. There are a lot of fiber supplements available in the market. So go see your doctor. If you're not able to get adequate fiber through your diet, maybe you can start on supplements, because pain and bleeding should not be tolerated long time in the postpartum period. You should get it sorted. Okay.
Thank you,
Okay.
Dr. Shubha. There's Samriti. Samriti, I just saw your comment that you're asking to please answer your question, but I do not see your question. I'm so sorry for that. Because in Instagram the questions just get lost. Samriti, if you would be kind enough to just post us a message, we would get it across to Dr. Shubha and she should be able to answer it.
You can
Yeah. So
just
the
ask
next
your.
question. Sorry, sorry,
No,
Dr.
I said
Shubha.
you can just ask your questions in the comment.
Yeah. Yeah, so the next question that I have is frequently farting after delivery, even after 6 months. She wants the reasons and the remedies for it.
Reasons could be hundreds. So check your milk intake, your gluten intake, your wheat products intake, you primarily what other supplements are you taking? Are you on long-term calcium? Are you on long-term iron supplements? Are you taking anything else? Are you a hypothyroid patient or not? So there could be hundreds of reasons for this. But even after 6 months, if it's not settling, then I don't know why you have not seen a doctor yet. Please go see a doctor. Okay? It should settle. Bloating generally settles in a week or two, but not for 6 months. If it's still there, you have to go see it.
Yeah, just something, general that I want to say, all the people who are watching this live session and, who will be watching this session, like, even after it is posted on our Instagram feed, what I want to say you really is if you're facing some severe issues, I think it's not right to wait, like, if it gets into some critical mode. If you're facing something, get it sorted. You can consult doctors. There are so many doctors available online. You can talk to Dr. Shubha. She is available. Okay, you can like just book an appointment with her. You just have to like, schedule an online consultation and she will be available. She will be ready because see, the questions that we have are kind of like, very specific
General.
in nature. No, I mean, we can answer general questions, but the questions which are very specific, Dr.
Specific.
Shubha really needs to talk to you. Okay, she really needs to talk to you to understand what are the other factors that may be affecting, like, the things that you are facing. So, what I would seriously suggest you is go and, like, have an appointment booked and talk to her. Or if you have any other doctor in your acquaintance, talk to that doctor. But then go and get yourself sorted out because like suffering is not really required. It's not really required. There are things that can be sorted out and there are solutions to the issues that you are having. So it's better to get and have a proper consultation done. The next question that I have is after a
Nilufar,
second.
1 second.
Yeah,
Nilufar. Sorry, sorry. She has posted her question, Smriti.
Samriti.
Uh,
Yeah.
so she says, wanna lose weight, mother of a 3 months baby, cesarean, breastfeeding. What kind of food should I prefer? I'm feeling weakness in my joints like knees and ankle.
If you're a mother of a 3-month-old baby, concentrate on the baby, feed the baby, and as you breastfeed, you are going to lose your calories, you are going to lose weight. Don't stress too much about losing weight immediately. And because I think Kareena Kapoor had lost 3 months post delivery, she went back to her pre pregnancy weight. I think social media has a lot of wrong influences. So take your time, enjoy your bonding with your baby, feed as much as possible. Breastfeeding is a great way to lose weight. And then you can probably take up, an online session or maybe an in-person session to get your abdomens and your Kegel exercises and your pelvic flow back to normal. So all that you have to do under a proper guidance of a technique or of a trainer, right? And if you're having weakness in your knees and joints, please be make sure you're on your calcium supplements. So it's very important to have your calcium supplements at least 6 months to 1 year post your delivery. Depending upon your gynecologist, they would advise. Personally, I took all my supplements up to 1 year, and post delivery, I think each gynecologist has their own set of how long to take supplements as to and how what all you are tolerating, what all you're not tolerating. So weakness in knees and ankle, I think it could be related to some kind of vitamin D or calcium deficiency. So get your vitamin D levels done, get your B12 levels done. If anything is deficient, talk to your doctor about supplementing. But don't get too stressed about losing weight right now. Enjoy your time with your baby.
Yeah,
Yeah.
Samriti, yeah, just one thing even I want to tell you is it's okay that you have gained weight, like, but think about the amazing job your body has done in delivering your baby, like, making your baby. You've made a human, okay? You've made a human, and that's a great thing, okay? You're just 3 months postpartum. Okay, I'm not saying it's not the right time to start working out or anything, but then, let your body feel that it's the right time. Let your body give you the signal that it's the right time. If you're already experiencing weakness in your joints, like, this is not the right time to start pushing yourself into losing weight. Rather than that, focus on, like, concentrate on what your body is actually trying to signal you out. Okay, and then we also had multiple sessions with postnatal yoga experts. You can actually think about having a postnatal yoga session, check out what your strength levels are, and then decide on the strategy that you want to take ahead in losing weight. Because losing weight, I think, Dr. Shubha, this has been like, the common thing that has been around. Everybody, just wants to lose weight after they have their baby. So that is something,
One minute. I just have a small call. I'll just get 1 minute, just 1 minute. Yeah, you continue. You just
Yeah,
continue.
yeah.
sure, sure.
Yeah, yeah, yeah.
So as I was talking, Samriti, losing weight is not the ultimate goal of being a mother. Definitely, like you want to get back
Yeah.
into your own body the way you were before you had your baby or the way before you had conceived your baby. But then that is not the ultimate goal. Okay, try to understand, try to find out what your body is actually trying to tell you, and then only after you feel the strength, you have the strength to work out, or you have the strength to take your body back into the stage it was before you gave birth. That's when you should attempt doing it. If you're just 3 months postpartum, as Dr. Shubha already mentioned, it's better to focus on strengthening yourself rather than focusing on losing weight.
It's important to start after the go ahead with your gynecologist also, because we don't know how your pregnancy went, whether you had complications or not, whether it was a cesarean or normal. So it's very difficult to actually advise over social media. But the best person would be your gynecologist to tell you, yeah, it's okay, you can go ahead with exercises. I think starting with basic kegels and then going on to abdomen exercises, like Vidya has said, some yoga, some stretches, and then you can start with cardio and everything. And don't lose hope. I had also gained close to 35 kilos post my delivery, and yeah, if we all had the same kind of gone into a lot of depression, then we would probably not be anywhere. So this happens to everybody. Somebody been there, done that. So don't lose hope. Okay.
Yeah, and something just to add to it, I've not yet lost all of my weight postpartum. Okay, I have a 2-year-old baby. I was like hardly weighing 50 kgs when I conceived my baby, and right now I think I'm I'm saying it out on social media, but I think I'm somewhere close to maybe 68, 69. Okay, so it's okay. You don't really have to see. I'm not saying that losing weight should not be your priority, or something else should be your priority. It depends on your personal goals, definitely. But then your fitness and your overall well-being is much more important than the numbers on the scale. Okay, so that's what you have to really think about.
And what
Yeah, have
defines
start.
fitness is again important. Measurements and your weighing scale do not define your fitness. Okay, I always feel, and I always believe also. I think my mom is overweight, but she's one of the most fittest people I know. She can work 12 hours a day. She can cook a meal for 50 people. She can be on her toes. She takes care of 4 grandchildren, and she is definitely overweight. She has all her other issues with blood pressure, but she is fit. So I think not going by a standard definitive size of 36, 24, 36, or being under 60 kilos and all, it doesn't work that way. Fitness is a completely different ballgame. Yeah. So I'm sure
Right.
you agree with me, right? Fitness does
Yes.
not mean you
Yes.
have to be in a whether this particular size or be within this kind of weight. I think fitness for me is being able to do my normal chores every day and still not get any
Exactly.
leg pain or any
I'm
kind of
feeling good. I'm feeling good about it. I'm feeling good and feeling happy and feeling
Yes.
having good
yeah,
feeling. That's
yeah,
what
good
is
feeling.
important.
Yeah, I work 12 hours a day, take care of your children, and then again after this life, I have to run back to my clinic. So I have, I feel that this defines my fitness rather than, feeling tired all the time, wanting to go to bed and just take a blanket. That is, the concept of fitness should actually change, So that's what I want to tell everybody. That change your definition of fitness, then you will feel fitter.
Right.
See, some
That's
people
very
are
true.
born with like Vidya. Okay, Vidya is like she doesn't doesn't
No,
matter.
no,
She's
no.
always thin. And
I was not born thin.
I'm always fat. Okay, so I don't know.
I was not born thin.
So I guess
I was
you're
very,
making a really good team.
yeah.
I'm a
Yeah.
fat and a
Let's
thin woman.
yeah, let's get to our next question, Nilufer.
Yeah, the last question, Dr. Shubha. So after second C-section, 3 months earlier, I feel nauseous. Or okay, so it's supposedly 3 months before she had her second C-section, and she's feeling nauseous all the time, and she also has a gallstone. So do you have any suggestions for? That's my last
Yes.
question.
How much do you weigh? And how big is the gallstone? Did you have the gallstone before your delivery also? Whether it's only one gallstone or multiple gallstones? How is your liver function test pattern? How is the rest of do you have fatty liver disease? Do you have cholesterol issue? So I want to ask you so many questions. But gallstones can cause nausea, and gallstones can cause acidity and all the other symptoms mimicking GRD. So if it is just one stone and it can be ignored, we can give you medical management and we can dissolve the stone. But if there are multiple stones, there are other issues in your liver, then maybe you need to opt for surgery. So unless I get a proper picture of your condition, I can't advise. But yes, gallstones now again are becoming very common because people are not being that active, I feel. A lot of people with
Right.
high cholesterol levels sleeping as soon as they finish their meal, not giving that amount of physical activity. Again, your diet plays a very important role in whether or not you develop gallstones. So yes, gallstones postpartum period, we are seeing a surge, and we are seeing a lot of new mothers who are less than 30 going in for gallbladder removal surgery. So I think there are a lot of ways we can prevent. I'm actually having a webinar on liver and gallbladder disease because over the last 1 month, I've probably done, endoscopic therapeutic, we called it ERCP, where we do a stent for a stone and remove it. So I've seen new mothers. I think one of them is also joined from Kerala. I think Jinsi is online.
Mm-hmm.
She had joined. We did a gallbladder surgery for her, and I had put a stent for her. So yeah,
Okay.
patients like this. And I think now it comes to prevention rather than treating. So get yourself more empowered with knowledge so that you can prevent it, your family and yourself from suffering. So that's the thing.
Right. Thank you for that.
Right.
Thank you for
I
that, Shiva.
I I have one question, maybe two questions. Yeah,
Yeah,
sorry,
please,
last.
please tell me, Vidya.
So, yeah, last one. Okay. So, will calcium and iron supplements have an impact on GERD? And do you recommend any foods to avoid, especially during the night?
Okay. Calcium and iron supplements can aggravate GERD if you are already having GERD, but it does not cause GERD. You get my point?
Okay, okay. Yeah, yeah, yeah.
It doesn't cause GERD, but if you're already having GERD symptoms, then taking calcium and iron on an empty stomach can aggravate GERD. Okay. And if you
Okay,
ask me between calcium and iron, which is more causative, iron causes constipation, calcium causes gastritis. It is proven. It is a
okay.
textbook. So in
Sorry,
patients
cancer causes, Dr. Shiva, I did not, iron causes
gastritis,
constipation.
gastritis.
Okay, okay,
It
okay.
can cause irritation of your gastric mucosa and your gastric lining. So iron causes constipation and calcium causes gastritis. You should never. Rule number one is you should never take both on an empty stomach. Rule number two is never take both at the same time of the day. Okay.
Okay.
And this is some basic rules which we tell people who are on supplements. And moving on to your second question, which you asked me, are there any foods which you can avoid during the night time?
Yes.
Fruits.
Citrus fruits. Okay.
Nighttime is better avoided. Raw, uncooked foods like fruits or
Okay.
salads which are raw and uncooked in the night because salads again have a lot of fiber and fiber can cause bloating. Bloating can aggravate GRD. So if you want to really have a bowl of vegetables, either boil it or stir fry it or bake it or maybe even make it into a soup and have it, but don't have it raw. Okay? And citrus fruits in the night and bedtime, please avoid if you have good. Please, please. Bedtime.
Bedtime? I
Milk,
didn't get that.
milk, milk.
Milk.
Okay. Right, right, right.
Bedtime
Okay.
milk, please avoid it.
But but there are so many people, Dr. Shubha, who are telling you can eat a salad for the dinner. How?
No.
Hmm.
If you have GERD, if you have
Okay.
greater salad, no. If you want, you can have a baked chicken salad or a baked fish, or you can have grilled fish, or you can have even a stir fry salad with a little bit of stir fry or a little bit of a bake. But eating raw salad is a very, very bad idea if you have gastric issues in GERD.
Yeah. So
Especially in the night, you say,
I'm
right?
sorry to
I'm
interrupt you,
talking only
Vidya.
about the night.
Yeah, Vidya,
Right.
to interrupt you, Vidya and Dr. Shubha, this, kind of I couldn't stop myself from asking this question. Okay, so Dr.
Yeah.
Shubha, I think this is going to be the last question, Vidya, if you don't have any more. Okay.
Yeah,
So
I'm
we
done.
have been having a lot of controversies, around the topic of eating or avoiding raw food during the initial days after childbirth. I'm not talking for the long term. I'm not talking with any issues. Okay, say like, a woman had her child delivered through any way. C-section or vaginal delivery, and what do you recommend in the initial few days? Is it advisable to have raw foods, or is it advisable to have cooked foods? Okay, because as far as the controversy has been going, we have been trying to highlight the fact that eating something that is easy for your digestive system during the initial few days after you give birth is definitely going to benefit you. It's not going to counteract anything. Okay, you are going to get the nutrients, you are going to get all the supplies that your body needs. Only thing is that you need to avoid cold food, which is not going to really help your digestion. If you're going to have warm food, it is going to help your digestion in some way. And avoid raw foods during the initial few days. So what is your
I
take on
agree.
that?
I completely agree. 110% what you said is true. Because post delivery or post any surgery, your gastrointestinal uh, tract is very, very, what do I say? It's in a stage of recovery. Although there's nothing major happening, a lot of hormonal changes going through that surgery, the catecholamine surge, the fluctuations in your steroid levels, all that can delay your digestion. So your liver, your pancreas, your bile duct, all this, whatever is the organs of digestion, actually need some kind of a rest for it to gain back its, physical state. Like you can't run a marathon as soon as you deliver. I know you need your muscles to recover. Likewise, your organs in your body are also made of muscles. They are also, something which need a lot of attention. So the best way to ensure that recovery is by eating well cooked and simple home cooked foods which are easy to digest. And I will say start with rice any day over wheat based. Okay, so whichever part of the country or world you're living in, I think rice is one of the things which are easily digestible. It doesn't really cause any kind of adverse effects. And I know a lot of people say, "Oh, eating rice will, lead to weight gain," and I say, "No, it doesn't. I can have rice 3 times a day, and I need rice every day. I'm a big lover of white rice. So yeah, eat for whatever is prepared at home, your home cooked, whatever's seasonal, whatever's local, whatever's homemade, and it's a good way to actually avoid uncooked raw food because raw food needs a lot of digestive enzyme, needs your body to work overtime to digest it. So you can probably delay raw food for a couple of weeks.
Thank you for that.
Thank you.
It really
Uh,
helped. Thank you so much.
Yeah,
It was
and
a real pleasure having you with us and having you talk
likewise,
about all
likewise.
the
Thank you,
important
Nilofer.
issues.
Thank you, Vidya. Likewise.
it was a wonderful session, Dr. Shubha. Such lovely insights we got from you, really.
Thank you, Vidya.
Thank you,
Thanks,
Dr.
nice.
Shubha. Thank
Yeah,
you so much for being with us today, and thanks. Thanks, Vidya. Thank you, Dr. Shubha.
Thank
yeah.
you.
Thank you, everyone, for
Bye.
joining
Bye.
us.
Thank you. Have a
Bye.
great weekend. Bye.
Yeah,
Bye.
you too. Bye.